Do you actually need treatment for your lumbar disc herniation? I'm going to show you an ad for one type of treatment that is somewhat misleading, and then I'm going to explain exactly why. Check it out.
Through our analysis, our decompression protocol, in 8 weeks, she was almost 100% pain-free. 12 weeks later, pain-free, no more pain. But did it work? That's your question. Did it work? We took a post-MRI because we wanted to see the change of the disc. It shrunk over 30% with our decompression program in 12 weeks.
So the question is, was it the disc decompression program that resulted in the reduction of the size of the herniation, or could this be something that happens regardless of the type of conservative treatment that is received? I want to show you an article right now that looked at over 2,000 patients and discussed the incidence of disc herniations that shrink up no matter what type of conservative treatment is given. Let's look at the article. So here's the article published in the Clinical Spine Surgical Journal in 2024. It's a meta-analysis, which means it looked at a bunch of different studies in patients. Over 2,000 patients receiving conservative treatment were evaluated, and they looked at the incidence of disc resorption. And as you can see right here where my cursor is, it showed an overall incidence of disc resorption was 70.39%. The highest amount of discs that were shrinking were sequestration, and then next for extrusions. And I'm going to do another video on factors that predict the tendency for lumbar disc herniations to shrink up. But their conclusion was, and you can read it here, that the existing evidence shows that the overall rate of shrinkage was over 70%, regardless of the type of conservative care that is received. So, does this mean that I think non-surgical disc decompression is useless? Absolutely not. It probably has a role. But as you can see, it is completely inaccurate and misleading to suggest that that treatment by itself reduced the size of that herniation. Herniations are going to reduce in size on their own regardless of the type of treatment received, and most of them will. As I said, I'm going to do another video on factors that can predict whether a disc herniation will shrink in size. And even if no treatment is received, in fact, I had a patient in 2002 that came in with a severe disc herniation. She was scheduled for surgery. And 3 days after I saw her, she called me to let me know that her strength was completely restored. Her pain was completely gone. She came in for a neurologic examination that was now normal. And I am going to illustrate that case because I was talking about factors that predict the shrinkage of disc herniation back in 2002 before many of these other articles came out. And I think that you're going to find this interesting, especially if you're dealing with a disc herniation or you know people who are. Thanks a lot.